When patients have dementia, getting a diagnosis can help them to maximise their quality of life. But across the world, only about 50% of patients with dementia get a proper diagnosis at the current time. In the United Kingdom, the first healthcare professional who's likely to notice the symptoms of dementia in a patient is the family doctor, which we call the general practitioner or GP. And GPs record all their information about their patients in electronic systems. Over time, more information about the onset of dementia is likely to build up in the patient record. And our idea is to take all the GP patient record information and use it as data to train an algorithm to predict patients' risk of dementia, so that we can feed this back to GPs and they can make the diagnosis of dementia at a time that's right for the patient. We have access to 100,000 patient records, all anonymised, from GPs across England, and we're collaborating with physicists to help us analyse the data. Why astrophysics? Well, GP data is really messy to work with. Sometimes patients will get a recording of a condition that they don't have, or they will be missing a recording of a condition they do have. And there can be long periods of time in the record where there's nothing there, simply because the patient has not been in to see their GP. Astrophysicists are used to analysing data that is both noisy and sparse, and they create complicated sets of mathematical equations based on Bayesian probability to bring the data in their galaxy databases into sharper focus, to find galaxies, and then to model galaxy features such as here, the galaxy spectra. It turns out that astrophysics data skills translate well into electronic health records research. A GP database is like a galaxy catalogue, finding a clinical condition is like finding a galaxy, and modelling galaxy properties is a bit like modelling the onset of a condition. We can use these techniques on our databases of real patients to bring them into much sharper focus and to make individual predictions about patients' risk of dementia. Our early findings suggest that these factors are going to be the most important for our algorithm to predict dementia, and we hope that at the end of our project we will have an algorithm that can be embedded in GP software to help them find their patients at highest risk. Our project is supported by the Wellcome Trust and the University of Sussex, and you can find out more on our website. Thank you very much.